This clinical case deals with an 82-year-old woman who was admitted to hospital suffering from chronic diarrhea, asthenia, and chronic abdominal pain. The upper GI endoscopy shows a hiatal hernia. The colonoscopy shows diverticulosis of the sigmoid. A small bowel video capsule was performed after appropriate bowel preparation, 2 liters of polyethylene glycol. The first step is to select the name of the patient from the list. This screen displays all of the features of the reading software, with the most useful for diagnosis being the Express Selected mode. At this stage, the quality of the recording is assessed, including the presence or absence of debris or bubbles. The 3D tracking graph is activated by thumbnail images of landmarks. For example, the first gastric image, the first duodenal image, and the first cecal image. Individual images can be enhanced or reviewed using these software functions. However, the diagnosis relies on the Express Selected mode, which allows selection of video images. On the upper part of the jejunum, tiny ulcerations and mild inflammation are clearly visible and captured on thumbnails. These limited abnormalities require attentive reading. Often it is wise to stop reading after 10 minutes in order to avoid loss of concentration, as review of multiple images can be boring. Redness around erosions is an important sign of inflammation. Multiple erosions are more visible in this view, with a clear recording without bubbles or debris. The ileum was reached after 40 minutes. Marked inflammation and incomplete stenosis is clearly visible. The capsule passage was delayed, and a diagnosis of Crohn's disease is obvious in the absence of NSAID use. more severe stenosis with deep ulcerations. As the capsule was temporarily trapped, multiple aspects of ulceration are visible depending on the angle of view of the sensor. In overview mode, an enhanced image is selected, analyzed with the multiple image bar, and stored. Despite the presence of multiple stenoses in the ileum, the video capsule could reach the cecum without clinical symptoms. In order to complete the report, adequate thumbnails are selected and included in the printed report. Medical terms stored in the software can be used to write the report. A physician's signature is mandatory before saving and finalizing the video recording diagnosis.